Hi everyone. I wanted to do a quick check-in and follow-up, I guess, in as to where I am at with my top surgery. I know I posted an update, and the update was to let you guys know that I actually had my mammogram exam. Um, and some thoughts on that, but I wanted to do a video about it. So, um, I am pleasantly surprised to have already received my results. So, I am super excited to say that it was negative, so everything is great. I will be going to get my records to be sent to Dr. Garramone in Florida at some point next week. And then after he reviews that, then we move on to the next set of exams or things that he may need. So that is like beyond exciting to me. I did, mention how this exam had caused me a lot of anxiety, um, and just an array of different feelings, because it definitely is a scary exam to get. Um, and I wanted to talk about that, about, what it's like for a masculine presenting individual or a non-binary person, and I can only speak for myself and my own experience. How, first of all, for me, because of my chest type, how painful the exam is, and second, um, how just uncomfortable it is to have somebody manipulate your body in such way. First of all, somebody's got to figure out a different way to do these exams. It's just insane. But it is very uncomfortable to have your body manipulated in such way, especially an area that you are already not feeling so great about, that you don't, naturally have a connection with. Um, yeah, so that's definitely something that's difficult. I was lucky enough to see a technician who I have been seeing for a while, going to the clinic that I go to. So it was um, a slight relief to see her face and to see a familiar face, and also, because I was able to be open with her, feeling a little bit comfortable to talk to her about, why this exam was a pre-op exam. So, that was another thing, which is also very interesting. It brings up another topic of, medical people that are in the medical industry having to learn all of this new language, or navigate around their language of, you know, the non-binary and transgender folks and so on and so forth. So it's really interesting to, see posts on Facebook about this, or like, read articles about the importance of this stuff, but to actually go into a place and actually experience it and be there, it's when it really hits you, and you realize that this is important. It feels comfortable to be addressed the proper way. It feels comfortable to be treated with respect. It feels comfortable for someone to know terminology and the names that we use for certain procedures and certain things like that when it applies to the transgender community or the non-binary, or whatever it may be. So yeah, they always say, like, you don't really know what it's like until you're there. So it's definitely important to work with individuals who are respectful, and who at least are trying to get it right. So with that, some of the things that I have learned, that just a quick, recap, is that, this is not an easy thing to do. This was not an easy thing to do. I can only imagine with how other folks with even more intricate situations in their lives feel in having to, go into hospitals and things that are where with staff that are not trained properly yet. So the importance of that is just monumental. Um, then the other thing I wanted to talk about is just that how surprising it is that you can talk to an individual and they don't know what a mammogram is or like what exactly happens when you have a mammogram. And I get it that, most physicians will recommend that you don't have checkups until you're 75 years old. And that's why it's important to do all of your self exams and make sure that if there is a change or something that you are having that checked out. Because this is how I discovered that there were irregularities when I was much younger, and that led to me having regular mammograms done. So yeah, just making yourself aware of like when it's a good time to go. When I know that they have changed now. Some physicians are recommending to have for women that are in their 40s and between 40 and 44 to have their first mammogram. So awareness, I think it's important, and just knowing what that means. Self checks, self examinations are, I think are super important. So yeah, I wanted to share the news that everything is okay, and that even though it was uncomfortable, this was a much smoother a much smoother experience than I imagined it to be. I had a lot of anxiety about it. I think that the pain factor of the process, was what had caused me even the most anxiety. But one great thing is that the technician did say that my chest appeared to be have a lot more fatty tissue than it did on our prior examinations, and that a lot of things that were visible there before are no longer there. So, which is a great thing. I guess as we age, our chest area will begin to start holding a lot more of the fatty tissue. So, which it, which actually made my examination a little bit more comfortable. So in terms of like the pain factor, so that was a good thing. Anyways, I know it's this video is kind of scattered, but the great news is that everything is okay. I'm moving on to the next step, where I'm gonna be sending all of the um, results to Dr. Garramone, and then just continue with my fundraising. I am again blown away. I have no words to express my gratitude, how amazing it has been to see everyone coming through and giving what they can and when they can. So again, from the bottom of my heart, thank you so much for helping make this possible for me. Yes, I have no words to express my gratitude. So thank you again to all of you. So this will probably be my last check-in, probably until next week when I check in with the doctor and send in all my information, and close to prior to the new year. So yeah, so I hope that you all have a great time with your families if you are visiting family. So happy holidays and all that jazz. And I will be checking in with you all soon.